Good morning, everyone. Now we'll see the next video of atrial septal defect. I'm Saranya, working as assistant professor in Triplum College of Nursing. This video will know about ASD. Let's move on to the video. The objectives of the video is we'll see the definition, incidence, causes, types, pathophysiology, clinical features, diagnostic evaluation, management, complications, and nursing diagnosis. Acyanotic heart disease is a heart defect that affects the normal flow of blood by including a hole in the heart wall. This condition is present at birth but may not cause any symptoms or problems until later in life. Sometimes the problem corrects itself during the childhood. So the proper definition is AST is an abnormal opening in the wall separating the right and the left atrium. So the incidence here is 17% of all congenital cardiac defects constitutes of AST, and it is commonly in girls than in boys. So the causes of the ASD is, first of all, the cause is unclear, but certain medical conditions, use of certain medications, environment or lifestyle factors such as smoking or alcohol misuse, certain genetic conditions like Fragile X syndromes, tuberculosis, sclerosis, and Down syndrome more likely to have ASD. So these are the causes of ASD. We'll move on to the types. The three types are ostium secundum, ostium premium, and sinus venous defect. Let's discuss each clearly. Coming to the ostium secundum. Ostium secundum is the abnormal opening present in the middle of the atrial septum. And next is ostium premium. It is a partial atrioventricular canal defect. That is, the defect is located in the septum just above the tricuspid valve and it is associated with the cleft in the mitral valve. And you can see the defects of atrioventricular septum. And next, coming on to the sinus venous defect. Sinus venous ASD is an abnormal opening at the top of the atrial septum. The opening may be located adjacent to the superior vena cava and it is commonly associated with anomalous connection of the right pulmonary vein to the right atrium or right superior vena cava. You can visualize in the picture that sinus venous defect is adjacent to the superior vena cava. So these are the three types of the ASD. Next, moving on to the pathophysiology, because of the abnormal opening in the septum of the atrium, you can have the communication between the right and the left atrium, and the oxygenated blood in the left atrium is under high pressure, which is leading to left to right shunting of blood, and this leads to burden on the right side of the heart. So you can have the increased pulmonary blood flow which leads to shunting of blood, but it does not cause cyanosis, which leads to pulmonary congestion and right ventricular enlargement. So these two things are the major one. One is the pulmonary congestion and next one is the right ventricular enlargement. Moving on to the clinical features. So, any children with the secondum or the sinus venous defect is usually asymptomatic, but in later life, that is in the third or the fourth decade of life, you can have a congestive cardiac failure. Mostly, the child who is having ASD will not tolerate to excessive play or exercise tolerance will be low and the child will have dyspnea and loss of appetite. These are the common clinical features of a child with an ASD. Moving on to the diagnostic evaluation. Diagnostic evaluation, you can First, coming to the cardiac examination. So, in cardiac examination, you can see the increased blood across the defect, which produces systolic ejection murmur, which is heard in the upper left sternal border. That is in the systolic ejection murmur is in the ASD, and fixed splitting of second heart sound that can be heard in older children, and ECG, right ventricular volume overload. Coming to the chest radiograph, enlargement of the heart and increased pulmonary vascular markings will be there. And coming to the echocardiogram, location and the site of the atrial septal defect as well as the dilatation of atria you can visualize. So these are the diagnostic evaluations which contributes to the ASD. Management. So, small atrial septal defect will close automatically, will be closed spontaneously on its own. But if the child is with ASD is hemodynamically stable, you can go for the surgery in between 2 to 4 years of age. If suppose the child is very symptomatic, you can do the repair. The surgical repair which is being planned and executed by median stenotomy, which requires a cardiopulmonary bypass. And the other side, if the defect is small, you can even close it by pure string closure, which is done by stitching it around the opening and pulling it, it is being closed. If the defect is large, a kinet Dacron patch is sewn over the defect. So these are the surgical management. And coming to the nursing management. So here the nursing management, monitoring of vital signs, oxygen saturation, even though it's an acyanotic condition, saturation has to be monitored, and constant monitoring of the heart rate, rhythm via telemetry monitoring, and frequent assessment of the symptoms and the patient monitoring is important. All patients with heart failure requires daily weight monitoring. So these are the nursing management. Coming on to the complications, postoperatively the child may undergo cardiac enlargement, dysarrhythmias and infective cardiac endocarditis. Otherwise, if the child with generally with the ASD will have pulmonary congestion or right ventricular enlargement. Coming to the nursing diagnosis, so the child may have a decreased cardiac output and impaired gas exchange related to pulmonary congestion, activity intolerance, because basically the child is not very active and the child will not be adherence to the exercise or play, and delayed growth and development and imbalanced nutrition related to loss of appetite and risk for infection. These are the common nursing diagnoses, and when you address to this, the quality of the life of a child with ASD can be improved. So, on the whole, an ASD is a hole in the heart between the upper chambers, that is in the arteria. The hole increases the amount of blood that flows through the lungs. The condition is present at birth. Small atrial defects can be resolved on its own, but the larger ones we have to address to the hole and we have to do the surgical management. So the references are these from the books. I hope you all have understood what is ASD and what are the causes it major causes and its types, pathophysiology, and what are the clinical features, and coming to the diagnostic evaluations and the management and the surgical management, and coming to the complications. So the all over concept of ASD has been well well imparted to all of you. So thank you for your patience listening. We'll see in the next video.